Yes, I'm okay, Justin.
Okay, all right, thank you. And Pam, it is noon.
All right. Hi there, everyone. My name is Pam Yankilov, and I'm the Director of Research at the University of Louisville Traeger Institute. And I welcome you to our Project ECHO, Care of Older Adults, in collaboration with the Kentucky Coalition for Healthy Communities. This particular Project ECHO, or quarterly Project ECHO, is hosted in collaboration with the Purchase Area Development District and Area Agency on Aging. And we will be hearing from Sissy Fox later on in our program. Just some technology tips. We're asking that you go on and click to see if your microphone is actually working. And you can go on and do that with those specific indicators there. You want to make sure that you go on and mute yourself. And if you want to talk, you can go on and mute. We do go on and also look at the chat very frequently. So if you have any questions, please make sure to go on and use the chat. And if you're having difficulty with your sound or your video, you can go on and click on that arrow next to your microphone or video to test your system. If you were to happen to get kicked off the Project ECHO, please feel free to join us via the phone. And so if you want to take a quick picture of those numbers, that'll help you either use the Zoom app on your smart device or just go on and call in, because we want to make sure that you go on and stay for this entire 2 hours, because we have a wonderful program on food insecurity for you. So as I said, this is in partnership with the Kentucky Coalition for Healthy Communities. And we thought we'd begin with just an introduction to KCHC. So how about we have Rhona Huff go on and come on microphone and share a bit about what KCHC is about.
Well, good morning, everyone, and thank you, Pam. We are a coalition that's a part of the ECHO that our goals are to create community support systems for the older adults in our communities. And we do that in partnership with our existing local coalitions and organizations. We also want to help develop the workforce and concerned community members to empower our communities to become healthier. And we do that in a variety of ways, and you'll learn more about that toward the end of the meeting.
Thanks, Mona. So if you are new to the Project ECHO community, let me just share a little bit about its history. Project ECHO actually launched about 15 or 16 years ago. It was founded by Sanjay Arora, who is an MD and a hepatitis C expert. And he felt that patients were driving 200 to 300 miles to him to receive his hepatitis C expertise. And he didn't think that that was a very good way of being able to create local capacity. So he developed this platform called Project ECHO. It is a telementoring platform. The idea here is to move knowledge and not patients so that we can build capacity at a local level. There's kind of a rhythm to a Project ECHO. It includes a few things. It includes a didactic. And then what happens is that there's a case. And through our learning through the didactic and the case, we work together in a teach all, learn all kind of community. And specifically, our Project ECHO is trying to learn best practices and interdisciplinary team-based care for the care of older adults. So in addition to our 1 hour Project ECHO, we then take the information that we learned and we talk about in a KCHC space about how it is that we can take the information to the community. Today, as our quarterly meeting, we have a 2 hour meeting because we're going to do a Project ECHO, and then we're also going to have a panel. So it's a very exciting time for us for this particular Project ECHO. And I hope you're looking forward to spending 2 hours with us, because we're going to be engaging our panelists and our presenters. If you haven't done so as of yet, I do ask that you go on and type your name and your organization in the chat box. It helps us get a better sense of who is in our learning community, and we get to know one another and see what your perspective is based on what organization you're a part of. So go on and type your name and your organization in the chat. Go on and do that just a little. Spell. Okay. And then if you haven't done so yet, we do ask that you go in and put your name underneath your little Hollywood video square. You go in and do that by hitting the 3 little dots in the upper right-hand corner. Click on it, and a little dialog box will come down. Click your rename and type your name. So today's presenters have nothing to disclose. If you are a community health worker who's joining us today, today is approved by the Kentucky Office of Community Health Workers to provide 2 CEU units for certified community health workers. So there will be a survey at the end of the time with us together in which you will be able to make sure you complete that survey and be able to receive that certificate for those 2 hours. If you're not a community health worker, there's also a survey for you in order for you to receive an attendance certificate if you would like that. But just to be clear, those community health workers must complete the evaluation in order to receive their certificate of their 2 hours of CEUs. So today we have our didactic presentation titled Food Insecurity, Understanding Service Gaps and Barriers to Resources. We are so lucky to have Clare Wallace with us. She is the executive director of the South Louisville Community Ministries. And I just wanted to share a little bit more about Clare to get a sense of her background. So Clare grew up in upstate New York and attended Syracuse University, where she earned a dual BA degree in policy studies and international development. After school, she traveled through Asia, vetting and consulting nonprofits for Global Giving Foundation, and then moved to Washington, D.C. to work on their team. Clare spent 2 years in the field with the Peace Corps as an agricultural volunteer in Senegal, after which she found her way to Kentucky. She since then made South Louisville her home. Formerly the Director of Development at Americana World Community Center, she also serves on the board of the Metropolitan Housing Coalition and is the chair of the Association of Community Ministries. Clare, thank you so much for being a part of us today, and we look forward to your presentation. We do ask that if you have any questions, you go on and put them in the chat. Claire's going to try to kind of keep a little eye on it as she's going through the presentation, and we'll try to feed some of the answers through that if she can. We want to give Clare the most amount of time for her to go and get through her presentation, and then at the end, we'll be able to get to some of those questions. And if we can't, Clare says that she promises she'll go on it and make sure that she answers them after the session. Thank you so much, Clare.
Thanks, Pam. Again, so excited to be here with you all today to talk about such an important issue. I have a lot. I could talk about this actually for probably a good solid 2 hours, but you all would get sick of hearing my voice. So I'm glad to be joined with lots of other experts. And I would love to also have enough time at the end for your feedback as well, and we'll get into why. So South Louisville Community Ministries, we provide all basic needs. We try to for our neighbors in crisis. So one of those, obviously, the populations that we serve are our older adults who have various needs. So we did a little bit more number crunching just this morning, and that 500 number for this past year is actually 1,500 because we looked more closely at the food numbers through our pantry of who exactly is coming through. So that's unduplicated 1,500 people just within the South Louisville area that we serve. So we are able to, through our programs, connect those folks with food, either through our Meals on Wheels program, where we have about 120 active participants. So we are delivering meals throughout the week to those folks through some partnerships. We have our commodity supplemental food program, like I mentioned before, our food pantry that serves the majority of that 1,500, about 1,200. And then we have some grocery deliveries as an option to help essentially ameliorate that biggest barrier, which is transportation, which we'll talk about soon. So we are able to very closely hear from and understand the complexity of needs that these 1,500 folks are experiencing. So we have that micro and direct service work, but it allows us to do some of the macro work that I'll talk about. The neighbor network is that. We are trying to, again, because we are hearing from so many of our neighbors who are experiencing some of these complex issues, we have just launched the neighbor network, which is essentially a coordination center. This is actually Jefferson County wide, because we understand that it's a need to connect folks both with resources across the county, but then also better understand service gaps and barriers. So we are hearing from a multitude of populations, including our older adults, about what exactly they're experiencing and how they are interacting with the resources that are available to them. We then had, through that feedback loop of communication with the people who are providing those resources, and services, but also the clients who are receiving that, we are able to better understand what those service gaps, why it's happening, and what potentially are those visionary alternatives. What can we do as a community to ameliorate some of those service gaps? And so we are excited to kind of lift up some of those possibilities. One of the things that we're doing through a lot of this neighbor network work is paying attention to how we are categorizing folks who are coming through entry points. Typically, what we've done is categorize by need. So the what. Is it food? Is it food? Is it housing? Is it digital literacy? Is it financial literacy? Etc. I mean, we have a long list that I'll go over in a second, but we are asking, what if instead of categorizing folks and doing the triage process, so like essentially splitting up the referrals by what, we are looking at more, we're looking more closely on the who are we talking about, and how we can serve them. And this, I think, has a lot to do with our older adults when we're especially talking about something like food insecurity. So we all know that all of those needs, all those basic needs, are so interrelated. They are, one affects the next one, and the sequence is important, and it's chicken or the egg a lot of times, etc. So through our intake, which is extensive, but can be done in about 30 minutes, we are trying to better understand who, through capturing, again, a basic needs assessment, definitely, but also to figure out if it is episodic or chronic, if it's stable and urgent. This is a matrix, and it moves all the time. So, where do you fall? I mean, I personally will sometimes fall on this matrix, depending on what's going on in my life. So most of the time, however, for our older adults, because they are on a fixed income, again, typically, they are under this chronic and stable category, which again means that we are, that there's an opportunity to work with those folks, but then also simultaneously, the option to increase income can sometimes be very complicated. So we are thinking about the how and the who, and assuming that the what is all needed and all affected by the other categories. And we'll talk about those categories next. So it's layered, and this sometimes changes a lot. A lot of times what we've done in the past as CCHWs and caseworkers, etc., is that we have steps to our goals, and our goals are X, Y, Z, and it usually is one of these categories. We know now that if food is a biggest challenge and therefore goal, that sometimes is often the first goal. So I want to have all of my needs met, all of my nutritional needs met. That's my first goal. And there are steps to be taken. We know now that oftentimes we need both transportation, basic supplies, digital access, etc. They are all feeding into and are related to that goal. And so it gets complicated because it can shift depending on prioritization and different crises, etc. So we're trying to figure out a way in which we can be extremely fluid and nimble in how we are navigating these basic needs, these what do people need? And so we are, again, asking about all of the basic needs within this list, but simultaneously, we are creating a process in which we can rearrange these steps and goals as often as needed, while making sure that they are all speaking to each other. And through this work, as we are navigating all of those various basic needs and those goals that clients have, we inevitably, because we're communicating frequently to see what has changed, what has worked, etc., we are naturally understanding some of these major service gaps and barriers we call friction points. So again, if we know that someone has a goal and they have a few steps to get to it, so they need, if you go to any referral center, for instance, so in Louisville, we have Louis Connect and we have Unite Us and we have 211, right? And statewide, it's 211 as well. And so if someone says, I need food, but I need it delivered because I have no transportation, the referral is Meals on Wheels. Okay, that's the next step. That's the hopeful piece. But we also know that Meals on Wheels is only available to a very specific population of people. And there's plenty of folks who are not eligible for that program specifically because they either have someone living in the household who's not able to provide assistance, they're not able to make those meals, or they have access to transportation, technically speaking, so they, again, cannot, they're not eligible. We saw an incredible increase in the pandemic because those eligibility requirements increased or loosened, I would say, actually. And so we saw the amount of people just in this one scenario of folks who are in the peripheries who need that assistance, who just don't really fall into that those qualifications. And so we are able to, again, pay very close attention to who those folks are in the peripheries, who are just not eligible for the programs that are technically there to serve that population and that specific need. And so we are looking very closely at some of these friction points and asking why. Okay, so again, in Louisville, TARC 3 is an option for a lot of our folks, but that has its own complications. There's a long list. We're looking into those whys. That includes if you have a bus stop too close to your house, then TARC 3 can't come. You have to be within a specific neighborhood sometimes. And then also it's really difficult to go to a food pantry and carry what is very heavy back to your unit. Some of the other friction points we see: digital access and connectivity. We all know this, right? Lack of accessible entry points to available resources. We saw definitely an important shift to having online intakes and ways to receive assistance. This has been exceedingly helpful in a lot of ways, but for our older population, it is definitely a challenge. Which leads us to the next piece, is that social inclusion spot. If we had a bunch of proxies, if we knew, or proximants is what I call them, and have that relational support, then we would be able to have someone help assist them through all of these processes. But we also deeply understand now how limited our accompaniment work, our accompaniers are. There's just not very many people who are able to walk with folks throughout the entire process. And so a good example of this is that there's a really cool farmers market program where our seniors are able to get a voucher and get local produce from local farmers. And they allow, and food pantries do as well, typically allow family members and friends to go essentially collect that on their behalf. But we also know that I would say a majority of the folks that we're seeing do not have that person who is able to do that supportive work that's fairly consistent. So we just have this disconnect of humans helping humans because, well, there's a lot of factors there. But we need, 1,500 community health workers if we're talking about, 10,000 people, even in just Jefferson County, who probably need the service. Continuing the limited extended healthcare. So what we're talking about here is if they are receiving any kind of healthcare through either emergency room services or even from their PCP. We are just exploring now the concept of food as medicine, and the infrastructure is not yet built in order to put those pieces together. And I know we're going to be able to talk a little bit more about that with our panelists today. And then, of course, our fixed income. So what we see a lot at South Louisville Community Ministries is that if something happens, if one thing happens, there's no income, there's no extra income to take care of it. So even if a microwave dies or a fridge, especially if a fridge dies, those are much more expensive. There is no wiggle room, absolutely none, in order to buy a new appliance. So a lot of our aging population will be without these basic needs in their kitchen for some. We have bought at least, I think, feels like 20 microwaves in the last year because of this. There's just no wiggle room. And when work is not an option, this is one of the bigger friction points. So the question is, okay, well, we know all this, we feel all this every day, especially as for the certified community health workers who are on this call. You live and breathe this. So one of the things that we're hoping to do through this neighbor network work is to harness the power of community through innovative service provider informed initiatives. So this is coming from both lived experiences of our clients, but then also better understanding the whys and the nuance of the situation by listening to and hearing from our direct service providers, and then lifting that up so that we can do something about it as both a city and a state. The tricky part is where to start. It all feels very overwhelming. The things I just talked about, those are huge systemic issues sometimes. So what do you do? How can you even begin? And I would love to just really quickly think about the friction points that I just mentioned and think about priority, urgency, and feasibility. So what we're thinking about here is priority is essentially how many people is this affecting is how we're looking at it. Urgency is how detrimental is that service gap to somebody's health and well-being and happiness? And then feasibility is there any room for growth here? Is there any room to make a change? So just for a second, again, think about those challenges that I talked about. And if there is one where you say, this is where I would start, I would love, because I am going to be using all of this data that we're collecting even here for some of this visionary alternative work. So if you could just write in, what do you think? If you're thinking about priority, urgency, and feasibility, what is one of those friction points that you would love to start with? And if you can just type it into the chat and push enter, that would be great. Justin, if you want to go back to the friction point slide, just to remind people of these 5 options. Take a second. I'm going to give 30 seconds, type it in, push enter. We're thinking about priority, urgency, and feasibility. Where would you start? You can choose one of these 5. Yeah. Super helpful. I'm seeing a lot of transportation. We get this a lot, right? Transportation affects everything else. It's also the most complicated, oftentimes. Housing is also definitely, I saw someone write that, is definitely a part of this as well. We are the highest number, let me try and phrase this rightly. The number of people who are becoming homeless at the fastest rate are our seniors. And we know that. So that is definitely a concern, because if you don't have a kitchen, how can you eat, etc. Or prepare your food at least. All right, so excellent. I would love if you can go to the next slide, back to that. Yes, and we're going to talk about food delivery programs in a second. So transportation, if we're thinking about that, how might we, if you ask yourself this question, and it's really hard to create room when we are constantly working with clients in these urgent, challenging situations, and all very complex and specific to that person. It's really, really difficult to step out and say, if we did this differently, what would it look like? This is giving essentially some breathing room and space to together think about how we might, again, as experts in this work, because we are so close to it, can maybe do it differently and maybe advocate for it to be done differently. So how might we provide transportation so that food insecurity, so if there is access to food assistance. So just, I'm going to give 2 minutes, I know we're getting up to time, but I think this is really important. 2 minutes, this is going to be super uncomfortable. I want you to give as much, just let your brain go. What if XYZ? What is a program or something that you could think of? Anything. Go wild. And if you can write it down, you can either write it down just next to you, but if you want to put it in the chat, that would be very, very helpful. So with transportation, what if we XYZ? Excellent. Yeah, I appreciate all of these. Starting villages, I've heard about the village to village network 100%. I think a lot of that connecting people to people in a way that's sustainable, that's monthly TARC cards. They should not be as difficult to get. 100% public transportation in rural areas. There has to be a way of expanding that. Opportunity. Connecting needs for both medical appointments, but then also extending that to food insecurity. That's a policy issue that I feel like could be tackled. This is super helpful, and I hope that I'll be able to get access to these notes. I'm seeing Pam shake their head. Yep. So we will take this back to our Rethink team. Justin, I think that will lead me to my last slide right at the end of my time. To say that we are thinking about this. We want to be that momentum, because there's not a lot of space for this innovation work. So we are trying to kind of use our pointy elbows and say, what if we, for real though, and helped both start those community conversations with folks like you who have these great ideas, but then connecting you all and others with people in power and funders, et cetera, to say, hey, we are seeing that this is a missing piece to the and very important puzzle, and we need your help to make this happen. And then move to advocacy, because, you know, we need to typically make a case for some of this. We also know that there is such a thing as man-made scarcity, and we are trying to create abundant programs. So that advocacy is key. And then lastly, in order for this to work, I believe we need those innovative collaborations as well. It's not going to be one sector or one person or one organization to serve these possibilities. In fact, it's gonna be all of us trying to figure this out together, both, and I'm statewide as well. So I'm over by 2 minutes, so I'll stop there. But I'm hoping that we can have plenty of time for these follow-up questions and conversation with our panelists.
Yeah, thank you so much, Claire, for sharing your expertise and having a thought-provoking chat opportunity here that we can ponder about those things and think of those as we move into our next part of our program. So thank you so much. We are now going to have a case presentation. We're going to have our recommendations taken by Chelsea Maselli, who's going to be writing down the recommendations. So when we go through the case, there's an opportunity for our Teach All, Learn All community to share recommendations to Alina, I think, who's presenting the case. So thank you, Chelsea, for documenting those recommendations. All righty, so we have Alina Roberts. She's the home care case manager from Pennyrile, the Area District Development and Area Agency on Aging. Thank you.
Good morning. Thank you. I appreciate that. Our case is about a 74-year-old white female, non-Hispanic. She lives in Clinton, Kentucky. She has a fixed income of Social Security of less than $1,000 a month, and express an assessment that there are times she doesn't have enough money for food. We give to the clients, I don't know if everybody can see it, but we give to the client a list of nutrition resources that they could utilize on each county. If you, the questions, one, what additional resources would you recommend for this client? Well, we give this, and then we try to help them as much as we can with the senior centers that they have for the county. And the question number two, what can community agencies serve rural communities do to further assist? And for me, for us, will be more funding for food and absolutely more access to it. Next. Thank you. This client has hypertension and diabetes. She is non-insulin dependent, which is great, but she takes care of the diabetes with medication and also with what she eats. So it's very important that she has what she needs when it comes to control her diabetes, and her hypertension, of course, is treated with medications. The clinical measures we do not have, so I'm sorry. Let's go to the next. Okay, so this young lady does not have any functional limitations. She has good cognitive functioning. She takes the medication for the hypertension and diabetes. She is concerned regarding her nutritional requirements. She struggles to buy food, and she currently receives the home delivered meals from the senior center. However, if it's not a 7-day-a-week delivery, number one, which is difficult, and number two, if the weather is bad, they don't deliver either. So she had times where she was lucky that she had enough food at home because she's kind of isolated where she lives. She gets supplies from us. Insurance is one of the things that she likes. However, the amount given a year per client is not enough. So at this time, she has zero money on her funding until, I believe, July. And so we try to help her with donated items, if we have any. Next. She is a high school graduate. She has a transportation barrier. She doesn't drive anymore. She lives in the county. She's isolated, lives around farms. And she didn't even realize that there was a transit system for her to come and pick her up. So she actually started using it, and I think that's helped. She has family, she has support, but they live far away, except one daughter that just moved in close to her, which is good. She's not stable economically. She has a limited monthly income. It will be very hard to survive with less than $1,000 a month. If we think of, they have to pay the water, the electricity, the gas. If they have a pet, they have to buy food for them. And so at the end, there is not much left for them to eat properly. We help her with the meals. We give her incontinence supplies. We have given her donated items for the household items for cleaning supply. She asks all the time if there is anything else that we could do to help her. Next. The client does not suffer from mental illness or any substance abuse disorder. However, she is mourning the loss of her husband, so she gets depressed. And so it helps for her to talk about her husband and her mourning process when I talk to her and when I have gone to her house. She is retired. She mostly worked all her life, part-time, on and off for 10 years, but she was raising her 4 children. And her husband was working on a farm. So that means that he wasn't home much to help her. So she does live alone. She has an inside cat and 3 outside dogs. Is her company in protection per se. Next. She doesn't use any substances. She always states that the meal delivered to to her is pretty much the big meal daily that she has, the main thing. So she really looks forward to it. She is compliant with her hypertension and diabetes medication, but that too costs money, unless she is on Medicaid. But if she only has a prescription plan for Medicare, that's another cost added to her, and they are not cheap. Next. She has access to care, but she must be sure that she can take the transit. Like I say, she didn't know that she could have transit where she lives. She has family members, but some of them live far from her, and just now a daughter is living kind of close to her. So she was having a hard time keeping up with her medical appointments. There are just few medical clinics in the area, and there is no hospital in the county. So more than likely that she has to go to Paducah, I believe, maybe. So it's about 30 miles travel for her. She also has access to mental health services if needed. She is not using it, but in December, in Christmas, she was really down. She really was, and so we delivered a care package to her, and that was one of the best things that we could have done. So I think this is a need that is not only for her, but for so many clients that we have. And she does have access to needed medication and dental care, but they are not cheap, so that cuts on her monthly money that she has to spend for food. Next. She lives in a ranch style. She is a one-level home. It's a simple home. There are no full house hazards. She keeps the house clean without clutters. We also, she does have home detectors in her home. She's a very sweet lady, and she loves our services when it comes to homemaking. Not only because our homemaker helps them with what she needs cleaning, but also just to have someone in the house for a little bit to talk, or just to have someone in the house so won't feel lonely. She has a good personal hygiene, and she appears well dressed. She's a very sweet and lonely lady. There are not many neighbors nearby, so she is pretty much isolated. Next. That's it, I think, as part of it. If anybody has any questions, we are welcome to answer.
All right, thank you so much, Alina.
You're
All right, so let's see, let me ask you one other thing. I missed what you said about, so what's her insurance? I can't find you. There you are. What was her insurance?
She has Medicare.
She has Medicare. Okay. Okay. All righty. So there are some comments and some questions in the text, in the chat. So if anybody would like to jump on and share, that's completely fine. So
Yeah, I read that question about the telecare. It could be probably a great idea, but we have to remember that this elderly that lives in isolated areas, they may not have a good internet access, or they may not even know how to use it. I remember one time she does has a Facebook page, but she didn't know how to add pictures of her husband when it was the anniversary. So they're very limited on that knowledge. It will help, but it's very limited for them.
mhm. Sometimes there's programs that go along that will provide, a tablet and provide access to the internet. Sometimes it's at a reduced price. Sometimes there's certain grants. I don't know if Barbara wants to talk about the virtual friendly visitor program that we have at Traeger that could also help. Perhaps we could provide a tablet. There's also, let's see, there's Barbara. I don't know if Barbara's.
Yeah. Yeah, I can talk about that a little bit. We do have a virtual friendly visitor program that is available statewide. That where we provide tablets to individuals who are socially isolated to connect to a volunteer friendly visitor. Sometimes those friendly visitors are students that we train to provide the program, and when we're able to find volunteers in the community, we also use volunteers in the community. We have in the past, and can, we continue to try to make provision for this, but we have in the past provided hotspots for internet connectivity for those who don't have it. There are programs, there are some federal programs that in many communities, and I'm not positive about the purchase area, but there are a lot of different programs that support persons who are low socioeconomic status with providing them with internet access in their communities. And I know some of it has to do with the actual connectivity in those communities. If the towers, et cetera, aren't available, then there are still some limitations. But in many communities, it's some individuals experience that mainly because they can't afford it. So we would need to know a little bit more about that for that particular person in order to determine how we can help them in that space.
So Alina, we can connect you to Barbara or myself or Justin, and we can.
Yeah. If you could send the information to Ceci or
Yeah.
us, yeah, that would be great. The more we work together, the better opportunities we have to help our clients.
So let's talk about the food insecurity. It says, so Mariana says, question one, local food banks, has there been connection to local food banks, SNAP, food card benefits through insurance, and senior citizen centers? Anything in that regard?
I do know, of course, she does. We do have a senior center for her, for this client. I am not sure if we have a food bank in Clinton. I'm not sure.
If I can, I don't mean to speak up and interrupt. I was just going to kind of elaborate on that.
Yes, please.
Here in Todd County, our senior citizen center does commodity food boxes once a month. And they will deliver to those that are shut in. So our senior citizen center has that. And then we have a local Methodist church that is also, both of them are associated with Feeding America. And then we have a local Methodist church that does a drive-through food bank once a month. And you drive through and fill your car with groceries. They do allow family and friends and neighbors to pick up for others as long as they bring their information. So in case they didn't have a vehicle or couldn't get out, someone could pick up for them. I know within certain city limits, we're able to deliver food. So just a little bit on that, but our senior citizen center does do the commodity boxes once a month through Feeding America as well. And that's a big help. That's a big help to that population as well.
That's a great idea, actually.
Well, we're going to be putting this on the list for you of recommendations, Alina. So we'll get you those too. Thank you so much.
Thank you.
Yeah, for turning on your camera. All right, so, Christina indicated establishing relationships with local farmers. Would you like to turn on your mic and share?
So I live around farmers, and I walk over to them and we have conversations, and we started building relationships, and I help them with things that they need. And perhaps she's not feeling well that day and the beans are ready to be picked, and I can go over and help pick beans, and then she'll give me like a pound of beans so I can fix them for my husband. I don't like green beans, but my husband really likes them, and it just creates a relationship that wasn't there before. And I feel was there a comment that the husband worked at one of the farms? The husband that passed away, I believe it indicated that he worked at one of the farms where she could establish those relationships.
Great idea.
And that way to help. because you said she was still able.
Mhm.
So that would give her a point of social inclusion, feeling needed, feeling that she can contribute. And
Yes,
so I just thought
that's
that was
very
a good relationship to build.
Yes, that's very good. Thank you so much. I put it down and I will talk to her about it. That is a great idea.
Okay, thank you so much. We have Nadia, who indicated that local churches may also have food banks to be willing to deliver food.
Yes, I do not have any information about the local churches around where she lives. I know that my church in Callaway County do that. We have what we call the blessing boxes outside everywhere in Murray, Kentucky. We have them everywhere. We have them outside most of churches, in the park, outside the jail. And what it means is people put food and hygiene products for the people that needs, and believe me, it is amazing how fast they disappear, the food. So it is very important, but we call them blessing boxes. And I wish we had that in every county, because I think everybody can contribute without, putting a name to it. Just, be a good Samaritan and put whatever is needed in those boxes.
Yeah. Well, good
Yeah.
point. There is a food bank directory, right? Do we know if churches are on those food bank directories? Or other resources, or do you have to have a designation?
Some of them, yes, and some of the counties, yes.
All right.
I was also going to say about it, the directory, the findhelp.org site is one that we use a lot for local food banks. And a lot of our churches are listed on those as well.
Great.
Good. This is like in Hickman County, there is only one place that we have on the list. So it doesn't have many resources, the area where she lives, I think that's probably the main problem, but I think there are many churches everywhere. So I think it will be a great idea to communicate with them and start that network.
Okay, great. And then Carla, would you like to jump on and talk about the telecare and the use of the 988 number to talk if she's depressed or become anxious?
Well, I was just in a seminar for telehealth telehealth first aid. And they talked about if you are depressed, or if you find that you just need to talk to someone, that you can call this 988 number, which is for suicide or depression. And she doesn't have to say anything. She doesn't have to really go into any details about her history, just if she feels like talking. Or telecare can call you Monday through Friday. They have volunteers that man the telephones to just kind of check on them, see how they're doing.
And are you saying it's 988, or is there can you put the 988 number? Is it a 10-digit number?
It's just 988.
Oh, it's just 988.
Yeah, it used to be the suicide prevention
Okay.
number, but
Okay.
now it's suicide and depression.
Yes, and it's literally like, it works like 911. So literally
Right.
all you dial is 988 and hit send, and it'll get her there.
Or you can text.
And Alina has a
Yes.
phone, right? She does have a phone. Is it a smartphone? That's something yes.
Yeah, I think she has a simple smartphone,
Simple
but she does.
Okay. And then Robert talked about a senior center in Frankfurt that has a commodity program as well, and that they also deliver. Amanda, would you like to jump on and share your comment?
Okay, can you hear me?
Yes.
Okay. I was just thinking about the programs that we have here at Henderson, where we do a women's group once a week. We do a senior gathering once a week also. And we are from a very rural area. I don't know if you know where I am here in southeastern Kentucky, but it's a very small rural area. So we will go pick up the ladies or gentlemen that wants to come, and they come to our campus. the ones that can, you know, they fix a small meal or whatever they can bring. If they don't bring anything, that's fine too. So we try to supplement with stuff that we will fix here, and they come in and eat and socialize, and that helps with their depression issues, you know, being isolated and stuff like that. We've had great success with both of those programs. But we do that, and then the men can also come to the seniors. The women's group is open to any age of women and young ladies that would like to come, because it's, you know, it's not just seniors that sometimes feel isolated, especially in these rural communities.
Yeah.
So we have that open, but maybe talk to some of the local churches to you to see if they would like to start, maybe have some volunteers once a week, and maybe do that, even if they just have.
Yeah,
a
that would be a
small-
great idea. I know that some of the, I'm not sure that it is with this one where she lives in Hickman County, but the volunteers base, you know, change all the time, you know, like they have a hard time having volunteers even to deliver the meals, you know. And so that's a big problem. But that would be a great idea if the churches could do that, definitely.
Anne, thank you. Anne, would you like to jump on and say something? Anne
Yeah,
Walden?
so this is specifically about the food bank. I know that and I see Sissy on the screen. So Northern Kentucky is kind of set up like Purchase, where we operate the commodities programs just like they do. So they have that advantage of they operate a food bank, and they work with the food pantries and administer the CSFP program, the Commodity Supplement of Food program, and the TFAP program. One of the things that we did in Northern Kentucky, and I just want to share, is we work with our meal provider to actually deliver commodities to people who aren't able to get out there and get them. And that has been really, really successful. And so whether or not they were, and that has been whether or not they receive meals, if they're eligible to receive commodities, our meal provider will go out and deliver the CSFP package monthly.
There's also a suggestion about using high school or college students for volunteer hours.
That would be a great
they
idea.
help with technology. I also don't know if they could also transport the commodities. I don't know if anybody's ever done that before.
Yeah, I think it is my opinion that, you know, that there are people out there that wants to help, and there's food out there to give, and there is money to give. We just have to, you know, go to places and be open about it. But I think, you know, the community needs to be part of it, not just one group, but the whole community to be
Right.
responsible for it.
That's right. Beth Morgan, would you like to talk about Lasagna Love?
Oh,
Beth talked about, is she here? Does anybody know if she's here? Would you like to turn on your camera and your audio to share about Lasagna Love? Okay, let me just quickly read it. Lasagna Love is an organization that will connect a local volunteer to a client who's in need and take them a home cooked meal once a month. Also ask client permission and sign them up for the program. So I don't know. So there are a lot of additional information that we're going to gather and put into the recommendations for you. Alina, we're going to go on and close out the case part of our Project Echo. We thank you so much for developing the case and bringing the case to us. And I'm so glad to the community for throwing all these great ideas in there. And we'll make sure we get those recommendations to you. And we wish the best to your client.
thank you so much.
All right, I'm going to pass the mic now to, I believe, Mona. Is that right, Justin?
Yes.
All righty, Mona,
Okay, we just want to remind you that the early bird registration for our optimal aging ends on March 19th. And our theme this year is aging and health equity. So we sure hope that you will be looking at that and become a part of this wonderful conference. Okay, so let's go on to the next, today's meeting, of course. Let's go to the next. So our purpose with our KCH is to train and empower stakeholders and community members to provide hope and education for their communities. And I think that you can see from what we've talked about today, there is a great need for us to be able to do that. So let's go on to the next. All righty, so now I'm going to turn it over and we're going to hear from our next speaker, and then we'll be talking more afterwards about how we can get all of these things that we're learning today to our community.
Good afternoon, everyone. My name is Sissy Fox, and I am the Human Services Director here at the Purchase Area Development District. We are extremely excited about today and just have had a great experience working with our partners in developing this webinar. So I just want to take a few minutes to tell you a little bit about the Purchase Area Development District and what we do. We offer a variety of services that touch every aspect of life in the Purchase region. We are located in far west Kentucky in the city. Our office is centrally located in Mayfield, Kentucky. And the services we offer include programs for the aging and disabled population, community infrastructure planning, economic development, workforce development, and special projects. So the ability to blend these offerings provides us a well-rounded approach to meeting the current and future needs of our region. Our region is comprised of 8 counties, most of which are rural counties. The Purchase Ad is also home to the Area Agency on Aging and Independent Living. We offer many programs to assist the aging population and their families. Some of the programs we provide include home care, family caregiver, the Kentucky Grandparent Program, the Long-Term Care Ombudsman Program, the SHIP Program, and congregate and home delivered meals. And Elena mentioned many of those services when she was doing her case presentation. Many of the programs that we provide are designed to help support seniors and assist them in remaining in their homes and prevent admission to a long-term care facility. Since the pandemic, we have seen a significant increase in the request for meals. And many of our rural counties, as Elena already talked about, have extremely limited resources to provide additional meal assistance. This has served problematic for us from an administrative perspective and a case management perspective in assisting our clients in meeting their basic need for food. So again, I thank you all for just allowing us a little time to talk about what we do here at the Purchase Area Development District. And I will hand it over. I believe we're just about ready to start with our panel discussion.
All right, thanks so much. This has been, you can hear a lot of the slight differences, similarities, possibilities, opportunities to learn from others that are doing a lot of this work and to scale it, either for your community or just within your own community. How can we do this better and for more folks? So we are hoping to continue that conversation around innovative solutions with 4 amazing folks who are on the ground, but also thinking creatively and definitely through collaboration. And so I'm really, really excited to just essentially hand over the proverbial microphone at this time. So if we could get started, Angela Wilson is at the Urban League and I'm able to be in close partnership with Angela, and we have gone through many, many case conferences, but also think on a large scale of how can we work with this paradigm shift. So as we go through, I would love for you and all of our panelists, Angela, if you could introduce yourself, the work that's around specifically food insecurity for our aging population, and then think of some opportunities, something that you're really excited about, or something that you could see as a possibility for your community around these innovative solutions? Angela?
Good afternoon. I'm so sorry. I'm in a room that is timed by the lights. So if you see me waving, I'm not partying. I'm just trying to get the light back on. My name is Angela R. Wilson. I am the Director of Health Initiatives here at the Louisville Urban League. Clare is right. We have been on many case conferences together and trying to find solutions. I value partners like Clare, where we really oftentimes have to think outside of the box to help some of our clients are in such great need. In regards to food insecurity and trying to service our senior citizens, Clare is right. We have visibly seen that the fastest growing population of homeless have been senior citizens. We get them into our office on a daily basis. And again, we also have to be innovative in trying to offer those services. Here, the Louisville Urban League is centered in the heart of the West End in the Russell neighborhood. And we really often have to fight, advocate, and protest to get grocery stores in our community. We actually have seen grocery stores be shut down, major chain grocery stores be shut down, and it has left our community and our population in a great need. We have tried at many attempts to foster relationships and plead to policymakers and to the city government in order to get more grocery chains involved, Walmart, Kroger's. I'm sure some of those have played out in the news media that you all have seen, and those efforts have all failed. However, we have plenty of Family Dollar stores. And then on the flip side, we always have to fight to keep Family Dollar stores from getting their liquor license, because we have a liquor store they're near every corner in the West End. So those are kind of our daily struggles. Those are our barriers. During the pandemic, and if you all recall, in the height of the Breonna Taylor protest, the 28th Street Kroger was vandalized very heavily, and it had to be shut down. There was a young lady named, I had to make sure I say her name right, Taylor Ryan, who created Change Today, Change Tomorrow. I feel like she just created it overnight. And volunteers jumped on board, and we were able to service those in order to make sure they receive their groceries. Taylor still runs that agency today. It is a huge help. Not only does she run the agency, they also have volunteers periodically who can deliver food to senior citizens or shut-ins or those who don't have transportation. But the target population was senior citizens, because a lot of them called that said they could not get their food, they could not get medication, they couldn't get the services that they needed. And so she jumped into action and she did that. She has a partnership with Trader Joe's where they give her their surplus food. And she said that averages out to about $400,000 a year. So I think that's a good investment. Our other place that we depend on to help feed our seniors is definitely Dare to Care. There was a new hub established in Dare to Care on 28th Street in the heart of the West End that was near some of the Family Scholar House. I think that was a partnership that was created through them. But we also have several churches and several community centers that offer Dare to Care products to their constituents in the neighborhood. I'm not sure that those community centers offer transportation, which is a great need. However, I do know that there are some agencies, like once a month or once every 2 weeks, they will provide specific transportation to specific seniors in order to transport them to the daycare care pantries in order for them to get their food. There are some, a lot of volunteers that also volunteer to help. I think someone mentioned about the struggle with maintaining volunteers. Sometimes they start out very strong and then they fall off. We also have that struggle as well, but we continue to try to find different resources. And then the last resource that I will talk about is one we try to use here at the Louisville Urban League, where we offer Kroger gift cards to those who are in need of food. We often get a lot of seniors and other individuals and families that are in need of food. We do have to advocate and purposely seek grants that are unrestricted in order to do that, because many grants that we do to fund our programming have a very strict stipulation that we cannot purchase food or purchase gift cards. And so we seek unrestricted grant funding in order to make that possible. So those are just some of the few things that we try to do. It does not meet the need. It does not meet the need, but we try our best every day. And that ends my 5 minutes, I do believe. Thank you all.
That's perfect. Thank you, Angela. I heard a lot of good opportunities that I think we can all lean into. The thinking about partnerships, but not solely within our own nonprofit community, but through multiple sectors, right? Thinking about how to make partnerships with grocery stores, but then also how do we equip our neighbors and our community members to be more involved. I've heard that actually come up through all of the segments of this conversation. So hopefully we can move back around. Now we get to hear from Amanda with the Henderson settlement. I have done a deep dive into this organization myself, because from what I can see, there is this deep appreciation for that local connection, those community efforts. And we all know at the heart of it, social inclusion and that community support that's the transformational work. So Amanda, I can't wait to hear from you. I'll pass it over.
Hello, I am Amanda Frasure, and I am the outreach coordinator here at Henderson Settlement. Just a little background, if you don't know who we are, we're right in the very end of southeastern Kentucky on the Tennessee border. It's a very rural community. I'm nervous about doing this. I talked to Justin about it this week when they came. Him and Chelsea were here for our community health fair, and I told him I was really nervous about what to say, but I've really enjoyed hearing all these ideas. But to give you some ideas of what we do here in our food pantry, we serve around 300 families. It's grown significantly in the last year. We do about 300 families a month. That's a lot for our campus here, that has us busting out at the seams. We do have senior commodity boxes that we give out to our seniors here. And where it falls, we are right on the state line of Tennessee and Kentucky, but we can only, service the Kentucky with those senior commodities. So I wish we could reach further. Some can get to me easier than they can their distribution center in Tennessee. We have and donations is how we are our different program here. We have a grant going right now that we can use for medical transportation. If somebody calls in and they do not have any transportation, but they need to go, like they need to Knoxville or Corbin or however they need to go, we can actually give them gas money to do that. Or we can take them ourselves, and it's through that grant that this is funded. It can help them pay for their eyeglasses, their dental work. If they have medication that they're prescribed and they're unable to afford it, we can pay up to so much. Each one has a cap, but that might be something to look into for other places if they could get in on that grant. We do get donations of like refrigerators and stoves and things like that. I'm actually looking for one right now for a senior in this community who, I don't know what all happened exactly, but she lost her heat, her refrigerator, and her stove all in one lick. So she's really been struggling the last couple of weeks on trying to get things in her house. The dollar store, we have actually, you know, they're everywhere now, and they have been giving us, they're over surplus of food and things. So we're able to hand that out also, which is a great thing. You know, if you have one close to you, you can find out about that. We also have a program that we work with that hires seniors, and that program does not go against their Social Security benefits. We have several seniors here on our campus that are working through that program, and it allows them to do different things. They get so much money per year, I think it is, that they can work on their vehicle if they have one, help them purchase tires and different things like that. And it doesn't go against if they do receive food stamps or anything like that. I think that's a great thing that we have. Let's see. If people do have lack of transportation, especially the seniors, we are able to take them to the doctor and to the grocery store, even, and different things like that that they need to do. You know, and that all comes back around to the grant. I'm trying to read my notes. Does anybody have any questions about what we do here?
I think we're going to actually be able to come back around, Amanda, and kind of put some of these pieces together as a panel. So I appreciate that. You know, I think, again, you brought up a couple of, I think one of the challenges is that we can get these grants, but sometimes it's very temporary. So the question is how can we make sure that the infrastructure that we built and the funding that we receive is long-term so that we can build up an infrastructure. And I think that that's something that nonprofits face all the time. So hopefully we can talk a little bit more about that in a bit. But we also get to hear from Tabitha today. So Tabitha Underwood is, I also have the privilege of working closely with her. And we are thinking all the time together about ways in which we can build infrastructure through a lot of innovative solutions so that all of our neighbors, especially our seniors, have access to food as medicine and just increasing nutrition. So I'll pass it over to Tabitha.
Thank you. So I am at UofL Health. I'm the Director of Community Engagement at UofL Health. We are a nonprofit healthcare system based out of Louisville. We're a fairly new health system, but our hospitals have been around for hundreds of years. We have 7 hospitals, we have med centers, we have 250 plus physicians practices in our community as well. So in terms of some of the food related work that we're doing, we're trying really hard to develop partnerships in the community because we know that we are not experts in food security. So we need to develop partnerships so that we can better the lives of our patients and engage our patients in those programs as well. One of the barriers that we talked a little bit about barriers, one of the barriers we've run into a bit is our staffing within healthcare. I'm sure you all know there's a lot of shortages in staffing, and it takes people to run programming and to develop partnerships and to keep those going. So we have all these great ideas, and it's hard to get them off the ground sometimes because of the resources within our system. We are using some of our existing resources to support food security. For instance, one of our hospitals, through our food service providers, prepares meals for Meals on Wheels for a couple partners. And we also do some funding around that as well. But we have kitchen space and we have discounts in ordering. And so the hospital is able to make that contribution through our food service provider. We have some pantries set up within some of our clinics. Some are prescriptive pantries that are kind of ongoing pantries that patients can use. Some are more for emergency needs, just to get, they're not prescriptive pantries. Some are just for emergency food needs at that moment. We have some piloting program going on around food as medicine for prepared meals, grocery prescriptions, things like that. It's very small scale at the moment, and we're piloting some of that across our healthcare system. I also am here representing Let Us Learn. This is a nonprofit based in Southern Indiana, and I'm on the board and have been for a few years now. It's a very small nonprofit. But they do some incredible work that I wanted to mention because they think a little bit outside the box when it comes to some of the food access in Southern Indiana. So their mission is to create access to healthy food through family and community engagement. So everything they do is trying to bring the community into the programming. They do food rescue, so from the farmers in our area, so through the farmers markets, as well as through particular farmers we have relationships with. We gather, kind of glean from them unused produce that they don't want to take back to their farms from the market. They actually, many of them will set aside boxes for us. We have volunteers that come pick it up, and then we give it out to the community every week in the growing season, in the height of the growing season. They gave away this last year, they work on a calendar year, fiscal year, and I believe we gave out 5,000 pounds just in that program. So quite a bit of food, all of it's fresh. We also have a local baker that brings bread and donates that, sometimes pastas there, things like that. They have started a meal prep program for low-income families to help them understand how to take that fresh local produce and stretch their dollars. So how to do meal prep for their families. Through that meal prep class, I will say it's very resource intensive. It takes a lot of time and a lot of effort and a lot of money to run it. But they feed the family. So the families come together for that meal prep. They feed the family. They provide childcare, transportation when they can. It's held at a local church. And then, so they make a meal, and then they do meals that they prep for the week. And then oftentimes there's a third meal involved as well that they eat together. So there's a lot of food prep that happens during that time. They also do school gardens. So we have school gardens in, I think, 5 of our Title I schools right now in that one county. They do school-based classes. So for, I believe it's 2nd and 3rd graders, they're teaching healthy eating, nutrition, mostly how to grow your own food in very small spaces. They've done gardening with youth and families where they've given kits during COVID. They gave out kits for gardens. We also have gardens at many of our schools. They do demos for a senior center. And so they take the food that's donated or grown in the gardens, and they take it to the senior center. They cook a meal together or a snack together, and then they're able to leave with food too. And then they have a lot of volunteer opportunities. So to combat some of that social isolation that we talked about, all of these programs are run by volunteers for the most part. And so there are a lot of opportunities as long as transportation isn't a barrier, because they're not able to provide a lot of transportation. Then anyone can come out and volunteer within the programs with little needed orientation into it. I think that's it.
Thanks, Tabitha. Yes, I think, again, figuring out how to do, I mean, so much of this work is coordinating human beings, right? Connecting humans to humans. Sometimes I feel like I'm just schlepping stuff back and forth, but a lot of it is figuring out how we can make these connections and sustain them when there are just a lot of different folks with different desires and schedules and life events. So hopefully we can also talk about that, where I'm making a long list of everything that I want to talk about, and I don't think we're going to get there. But Lastly, but not least for sure, is another good friend, Rhona, with Feed Louisville, talk about being nimble. And I say this is the best compliment that can come from me, is scrappy. Making sure that we are going where the need is, paying attention to what that need is, and kind of addressing it as it comes. So just very excited to be able to hear, especially about that process of learning and then adjusting so that needs can be met within our community. So I'll pass it over.
Thank you, Claire. I am so happy to be here. Thank you, Justin, for inviting me. And it's been so inspiring to hear the work of everyone here. And just, it's amazing to see how all of us are working in our different ways to help to feed people, which is my passion in life. I'm a chef by profession, and we started Feed Louisville. This is our 4-year birthday this month. We started at the beginning of the pandemic. Thank you. And we thought we would do this for a couple of weeks, and then the community responded, and we saw that what we were doing, there was a need for it. We started out, making some meals that we started out in a partnership between myself and my co-founder, Donnie Green, who has been doing street outreach with the unhoused community for years. And so we were, I built a team of chefs, and we started sending this hot meals and other food resources directly out to the camps. So we still work primarily with the unhoused community. Over the past, 4 years, Donnie built up his team. We built the Arthur Street Hotel, which is a housing navigation program. We bring people off of the streets into the hotel for an unspecified period of time, and then move them into housing. So last fall, 2 things happened simultaneously that sort of shifted Feed Louisville a little bit and allowed us to expand the capacity that we're at now. We decided to separate the Arthur Street Hotel and our street outreach team into its own entity. So that happened. And then at the same time, we moved into a larger facility. We were in a 500 square foot kitchen, and now we're in an 8,000 square foot space. So those 2 things happening at the same time allowed us to start to expand our partnerships in the community. We are a food rescue. We reduce food waste in the community and hunger. So we're at the intersection of food waste and hunger relief. We have about 100 restaurant partners right now. We're partners with Dare to Care, countless farmers. We take in, like Let Us Learn, which is an organization that I love dearly, that Tabitha spoke of. Like them, we take in food that would have gone into the landfill if we weren't able to rescue it and make good use of it. This is perfectly viable food. We are all professional chefs. My team is made up of chefs who came to me from Anoush and Béarnaise and Le Relais, and really are good, quality restaurants here. So they're professionals. They're 30-somethings who are very passionate about food justice and wanted to do something meaningful with their skills and their time. So they work really hard to take this food in and make something beautiful of it. We vet all of our partners. We only take food from restaurants or producers who are safe food handlers. And so in addition to, we take in food that comes from caterers, it's ready to eat. Sometimes we're repurposing it. Sometimes we're able to just heat it to temp and send it back out. We package the food into individual meals daily, but our chefs are also producing meals from scratch with these other ingredients that come in, raw ingredients. So that's, we're 5 days a week producing up to 1,000 meals a day in our new space, hot meals that go directly into the streets. The other food that's coming in, we're part, like I said, Dare to Care, Target, Walmart. A lot of the resources that are coming in are not really things that our chefs can use to make meals. So we have this whole other aspect of our organization, of our work, that we have a big warehouse now. This food comes in, it's, it might be canned goods, it might be frozen, ready to eat foods. clothing. I mean, all kinds of things come in. So we triage everything that comes in, and we're able to get that back out into the community. We are a hub for resources. And so with our new partnerships, we have 10 different partners right now, and those include the Arthur Street Hotel, the Hope Village. So our partners are made up of street outreach teams, organizations going directly into the camps every day or the streets, taking food and other resources. We're also partnered with Up for Women Day Shelter. They're working with the unhoused community. All of our community partners are serving, our older neighbors. I would say, anywhere from 10 to 20% of the people that our partners are serving are in that age category. So this is very relevant. And as well, we're working with some small food pantries to get out some of these ingredients that we can't make use of. And those include Sister Visitor Center. We're partnered with Change Today, Change Tomorrow, as Angela mentioned. And so with this expanded space and these expanded partnerships, we're able to help meet the needs or share resources with multiple organizations. And one of the things that I think is significant for us, we really have evolved into being, we are a hub, we are a commissary kitchen. We currently do not serve any clients directly. Unfortunately, my team is very upset about that. The chefs would really like to be more on the front lines, but our job, our expertise is cooking food and handling it safely and sharing resources. So we are supporting the work of all these other organizations doing this work. And what I love about it is that we're able to free up in some cases, for our street outreach partners and Up for Women, for example, these organizations who are doing housing navigation, and they're working with substance use issues and mental health issues and all the things that we're talking about today. We are able to take that one piece of it, the food piece, and help, them to take that off of their plate, so to speak, so that they can focus on the other things they're doing. And I love that about our work, and I see us really continuing to grow that capacity, for our partners. So I apologize about that. So let's see, I wanted to talk about, so you were talking about barriers and challenges. Our partners that we're able to get hot meals to every day, that is, obviously that's a need, that's something that's so needed, and that we're able to do that for them. But when we talk about all these other raw ingredients and, and ready to eat and shelf stable things that are coming through, one of the challenges we see, we don't consider ourselves a food pantry, because when we put together, if we're able to put together a house box, we call them, so a grocery box, most often these boxes, they do not make a cohesive meal. You could not take those ingredients and make a meal out of it. So this is very pieced together, right? And we realize that. So we're able to share the ingredients out with other food pantries, but we're also seeing them have the same challenge. And it's an ongoing challenge. And I think for anybody that has a small pantry, I think that even a bigger food bank like the Dare to Care experiences this as well. So it's a challenge, and I think it's pretty universal. I'm sure all of you have experienced that. So one of the conversations that we're having with some of our food pantry partners is around being able to have ready-made meals available. So for example, we're talking to Sister Visitor Center about that. In fact, we've talked to some healthcare organizations in the city who have small pantries in some of their doctors' offices about, there's this difference. This is one of the things that I'm coming to really realize when we talk about food insecurity, there's these different layers. We consider our work every day to be hunger relief. This is the immediate crisis need. The folks that we're working with are people who perhaps they don't know where they don't have access to food at all. So we're meeting an immediate hunger crisis. And then, so we're seeing that even with some of the pantries with people coming through, if they're able to get a bag or a box of groceries, they may not have eaten today. They may not have the means to produce a meal like you talked about, Claire, maybe that they don't have the proper equipment. And one of the things we have all seen is that folks don't have sometimes the knowledge, the energy, the health, whatever it is to prepare a meal. So I think that we're starting to see that where our role in the community comes in is being able to make ready-made meals that can go out. We're piloting a program with Sister Visitor Center where with their grocery boxes are starting to send out ready-made meals to folks who are pretty much homebound. And having that conversation as well with healthcare companies about putting some of these ready-made meals into freezers in those food pantries so that when they have someone in front of them that really is experiencing acute hunger in that moment, that there is that meal that can be pulled out to take care of that for today, for that moment, and then work on those other layers, right? Getting those groceries, getting that SNAP benefits, whatever it is. So that is where we're at. I think that's, I think I'm happy to see people here from around Kentucky. And I would say that this model of bringing in food rescue and having, chefs, cooks in the middle of it and then getting it back out is very replicable. If any of you who are out in other places in Kentucky have interest in doing something like that, I'm happy to talk to you about the model that we've developed. I appreciate being here today.
Thank you. Thank you so much. I wonder, and feel free for those listening, to add your questions to the chat. I think we have some time to honor that. But I have one, and it goes from food rescue and food prep all the way to recruiting and coordinating volunteers, and that's liability. When it comes to food, I feel like there's a lot of challenges specifically around navigating a lot of those legal barriers, or at least insurance barriers. So I'm curious, you need to have a commercial kitchen, etc., and that is just a huge cost. I would love to hear from our panelists around specifically how you all have worked out home visits and trainings and again, preparing food in the way that you're talking about, in a way that we know is safe, and again, also just legal. Because I think that is a lot of times a barrier that a lot of the smaller nonprofits too are facing. If anyone wants to start.
Well, I'm happy to speak to that because it is something that we're always working with every day. Yes, food safety is critical, especially when we're always, but especially when we're dealing with a more vulnerable parts of our community. So one of the things that we do, as I said, we vet our partners. We don't take any food that's made at home. People call, and I know it's delicious food and made with so much love, but knowing that food is prepared in a commercial kitchen by people who have licenses to do it in education, I think is really critical. But one thing I would say is that there are lots and lots of churches around our community here in Louisville that are sitting there. They have commercial kitchens, and I know that there are some of the best cooks in the county, in these churches, who could do this work in a similar way. I will say this from a legal standpoint, we operated the first couple of years under the Good Samaritan Act. We knew we were covered by that. We've had many talks with attorneys about what we were doing, but the Biden administration last year, or no, it was 22, I think January 22, strengthened that act and added extra layers of protection for any of us doing work, providing food for those in need. Yeah.
Very helpful. Thank you. And it sounds like for me too, I hear a lot of possibilities when we're thinking about finding ways to be nimble around creating, delivering food options, and then also simultaneously building up social inclusion. I wonder where food is medicine is coming into this. So this idea, and Tabitha, I'll probably call on you on this one. What's the low-hanging fruit there? How can we move forward so we can have not only comprehensive meals, ready-to-eat meals, etc., but meals that are also reflective of the dietary and nutritional needs that our aging population, especially, and diabetic population, et cetera, can have access to. Tabitha, any thoughts on that?
Yeah, it's complicated. So I've been working with Rhona on it, and Rhona, we need to renew our conversation because there's some other things that have been in motion. I think the struggles that we've had with the food as medicine or food as health, whatever you want to call it, is if you look at the hospital side, we're short on space. So it's hard to figure out how do we have meals here. So if we can't have meals here at the hospitals, then how do we get them to our patients, right? So that's one piece, is the transportation of what does that look like and what partners can do transportation in this space. The other piece, as I mentioned, staffing. So there's we would love for our registered dietitians to be able to run with these programs because they are the best trained. They are subject matter experts in this field. And it's just, there's so much work to be done around nutrition that it's hard to pull any staff out of clinical space to be able to run a program through the hospitals. On the clinic side of things, same with transportation. You know, clinics don't have space for housing meals or prepared meals, but is there another way to do this? We run into transportation barriers as well with if we do, for instance, grocery prescription or grocery prescription cards or anything like that, because if there's not transportation to and from the grocery, that can be a barrier as well. So I know that doesn't sound very uplifting. There's a lot of barriers with this. I think there's also opportunity, especially in our community. We have places like Feed Louisville, we have Dare to Care, we have lots of places that are interested in this space. So I think together we can collaboratively figure this out. I think it becomes harder in rural communities where there may not be the same kinds of resources, and you have to think a little bit differently about how to put those together.
Thank you, Tabitha. Yes, so MCOs, insurance companies, this idea of providing meals as benefits. But I wonder if feel free to add into the chat, you all, if you do know of anything. I know that Dare to Care here in Louisville was trying very hard to get DoorDash to be able to pay for those deliveries. We got really close, then DoorDash pulled out. I really do hope that that might be something that we see again. But I would say in the meantime, a social enterprise model where we are paying people who need that very flexible income is a possibility as well. And so obviously transportation is still required, but what if we purchase the vehicle, et cetera? Again, liability, but these are all issues that we can work through because it's a matter of just asking the right questions. Angela, I see that your hand's up. Would love to hear.
Yes, ma'am. I don't know if somebody mentioned it. I did hear someone say something about insurance companies. So I know Medicare, Humana, and I think Aetna right now, they offer like a benefits card it's a cash card where clients can purchase groceries, purchase medication, anything that relates to improving their health. So sometimes when we get phone calls in specifically from seniors that are in need of some type of food resource and they can't get to a Dare to Care or they can't get to one of the other resources that we have, I always tell them to check with their insurance company because they should have a resource there.
Thanks, Angela. Tabitha?
I will mention there is also through UK, they are working on a Food as Health Alliance. It's in the beginning stages, but it's a referral hub for food as health programming. And the goal is we're starting some pilot programming with them in our clinics. So the goal is that we wouldn't have to run programming, is that we could refer patients who have a diagnosis that is food related and that they connect them to Food is Health programming, whether that's prescription cards, prepared meals, all kinds of things. They've worked out the transportation partners. They've worked out the access to the food through both local partners and national partners. So I will mention that they're getting started. They're in the building phase of piloting the programming and collecting outcome data right now.
Yeah, that's beautiful. I feel like what I'm hearing too about where partnerships really click, Rhona talked about this too, is where, again, we're knocking down silos by building lanes, saying, this is what I'm good at, but I need these 3 other partners in order to create this comprehensive program. I can imagine that might be a little bit because Louisville in an urban setting has a little bit more of the choices around partnerships. And so I can imagine that in more rural areas, there's probably a lot more like we just have to do it all ourselves. And so I do want to, and I would love to talk more about that, but I do want to leave a little bit of room for that question around advocacy, because I know that is definitely a part of this. So I want to highlight both Food in Neighborhoods. That is a lot of multiple partners here in Louisville that are coming together to pay attention to that advocacy work very specifically. And there are some really interesting pillars. The way that they're breaking that down is really, really helpful. But I also saw that Kelly is on with Kentucky Voices for Health and would love to hear from you all really quick about some upcoming advocacy that we can all participate in if you are able to do that, Kelly.
Yeah, and thank you. I've really enjoyed kind of like listening in the shadows to your meeting today. It's really important work. I think you all are seeing it like live time where the rubber meets the road, some of the needs. I would encourage you, before I kind of share some not great news about an advocacy opportunity, if you are not already a member or following the Kentucky Food Action Network, this is a small coalition partner of ours that focuses purely on food policy, food insecurity. And I feel like you all are great catalysts for that change as well, and would be eager to kind of receive those updates, maybe be more participatory in their meetings. But that is a group that is very active in Frankfort and following food policy in particular. There is one bill right now, well, there's lots of bills that would unleash harm in terms of food insecurity, but one in particular that KVH has been following a little more closely than usual is House Bill 367. And for anyone here who receives our updates, you've probably seen a few calls to action in our newsletter or social media. Yesterday, I'm going to be brief because I know y'all are trying to wrap up. Yesterday, the vote on the bill that was taken in committee was failed. The bill did not pass committee. However, we feel and are starting to hear that the issue is not over. And as you all know, in Frankfort, they can amend any bill at any time until sine die adjournment and egregious policies still move. This one in particular would eliminate broad-based categorical eligibility, reducing the gross income eligibility from 200% to 130% above the federal poverty level, and also prohibiting the state from putting in place waivers for the able-bodied adults without dependents, flexibilities that they have right now for counties with high unemployment when there are circumstances like natural disasters, factory closures. There's all sorts of issues that arise that we can't anticipate but know are going to happen. And policies like this would essentially make individuals have to be completely destitute before they would be able to access SNAP benefits, essentially. And we've tried it before. The last time we've ever, experimented with this type of policy, thousands of Kentuckians lost their benefits almost overnight. And right now it's estimated that at least 4,500 Kentuckians in our aging population would be directly harmed simply by the language that's currently floating out there. That's in a nutshell, because I know I'm really time limited here. I would love if anyone has questions, would like to learn more, would like to talk in more detail about that. I'm available. I'm gonna put my email in the chat. If you are not following our alerts and would like to know more about this bill in particular, and maybe your role in reaching out to legislators and just saying, this is the group of Kentuckians I personally help and work with, and this is our fear over these types of policies. That's important, and you have a big role in helping us to further delay it. We had a short-term win yesterday, but they do not adjourn sine die until April 15th, so it's not over till it's over. And that's it. In a nutshell, House Bill 367 is a bill we are very fearful of.
Thank you, Kelly. Yes, and just to reiterate how important your voices are so key. Doing this advocacy work, it's one thing to have, a policy expert talking to legislators and do that work, but it is an entirely separate thing to have those stories over and over again saying, this is not one person, this is so many people I see, and this is how it's affecting me and my life and theirs as well. Those stories go a really long way in advocacy. It's hard to create room for that extra work because it is, I think, emotionally draining, at least it is for me. But it's so key that we take that microphone sometimes and use it. So I just appreciate you all for being here for this conversation. I'm also going to put my email into the chat. We will be doing a lot of work around the visionary alternatives that you mentioned, a lot of really good questions and conversation that we'll be looking into, so none of this just ends at this call. So again, I'm grateful and am happy to pass it back over to, I think, Pam.
Thank you so much, Claire. I think, Rhona, did you want to conclude this part or?
Yes, and I would ask, I think that we've done all this, and this has just been incredible. You don't catch me speechless often, but I'm just about there. But I just would like to kind of encompass, and if you could go on over to my slides that talks about the programming coming up. But while you're doing that, I just want us to remember some of the main things that I think that we heard today. And one of them is, if someone is hungry, really nothing else matters right at that point. And we can't help them in any way without finding proper nutrition for them. I like the part about the power of community, and let us never underestimate the power of community. And let's start community conversations right where we work, eat, play with everyone. Let's advocate. Advocacy is so very important, and they need to hear our voices. The squeaky wheel gets attention, and we have to let them know that we are concerned about our people, because we are humans helping humans. I heard that, and it's important for us to know. One thing I heard that really concerned me, and I think all of us need to really be thinking this through, and I know that I'm doing it. In fact, last Monday night at our My Health Matters, we talked about food as medicine. Okay, so we're preaching that, we're teaching that, but the comment was that we don't have the infrastructure to handle that. So let's start thinking about, what are we going to do, and how are we going to make a reason for a person to want to look at medicine as food as medicine. So individually, what can you do? Well, I would say find a coalition. Kentucky Voices is a very good one if you want to statewide and learn so much from them. But try to find a coalition in your immediate community, or a ministry group, that you guys can start talking about the problems in your community and figure out how your community can work into the solution. I like that comment too. And one of the things, let's remember our farmers. Many of them are wanting to help. They don't know how to help. They've got food rotting in their gardens sometimes, and if they just knew what to do with it, they would do something with it. So that's my little tidbit about today. But I do want to share with you some things coming up. We are going to be starting another Flourishing Together class, April 12th through June 14th. And that's a free 10-week class. And what we are teaching is food is medicine. We're teaching that walking is medicine. We're learning how to stress less, and we're becoming a healthy group together. But we need to also have some answers how we can help them to get to that food that is proper. We're going to learn a healthier lifestyle to prevent and manage diabetes, heart disease, and other chronic diseases. Go on to the next slide. So we can talk a little bit about My Health Matters. My Health Matters is an education and support group that we do every Monday evening. We have actually been doing this since the beginning of COVID. Prior to that, I did it once a month as an in-person, but we started doing it weekly, and our people have asked us to remain doing that. This coming Monday night that I will be teaching on walking is medicine, and I would love to see a good number of you here. But I do want you to jump ahead and look at April 1st, what we're going to be talking about. We say that fresh matters, and we've got Bethany Pratt coming, and she's going to be giving us some hints on how to do gardening, and specifically how to do some porch gardens for our seniors. And so if any of you have some ideas that you could help us with that and would want to be a part of that, please come and share with us. Okay, so let me turn it back over to Pam now. As we're doing that, though, just look at this pledge. It says that we're going to become an effective state coalition working with community members and community-based organization to empower our state to become a healthier and compassionate people. That's what we want to be. Therefore, we will practice self-care and model healthy behaviors to our families, co-workers, and members of our communities. I hope you take that to heart. We'll see you next month, or perhaps at My Health Matters Zoom class. Okay, Justin or Pam, whichever one are you going to end, I'm yielding it to you.
All right. Thank you so much, Mona. Thank you so everyone for making our Project Echo so amazing. I think Justin's going to give a little bit of message here related to our Optimal Aging Conference.
Yes, thank you, Pam. And so we talked earlier about the conference that's coming up in April. We have, hold on just a second. I'm sorry, I'm multitasking. We have early bird registration closing on March 19th. We do have limited number of scholarships available for community health workers. So I put my email address in the chat. Please email me if you are a community health worker and you would like to apply for a scholarship. Now I am going to do the business of making sure that everybody completes an evaluation. Particularly if you're a community health worker and would like a certificate, that you must complete the evaluation. But we invite everyone. You can either use the QR code here on the screen or the link that I just put in the chat. So we so very much appreciate this very rich discussion. I appreciate Claire and all of our panelists, Elena and the Purchase Area Development District, Area Agency on Aging. This has been a real treat. This is a great way to cap off like a really long week, but like this was such a rich discussion that I'm excited. We have some great conversations here, and hopefully we can find ways to continue this conversation outside of this meeting. So Claire or any of the panelists, do you have any closing comments before we wrap things up? All right, so please do the evaluation. We hope to see you in April. We'll be back with legal aid society information and how they can help older adults. And then we have 2 more sessions in this series, older adults in the criminal legal system and trauma and its effects being rescheduled from January. So we appreciate everyone for being here, and we hope to talk to you soon. So I am going to stop recording, and everyone, you are free to go, but we